I'm Micah, and I'm sharing with you a poster of our study that looked proactively for vulnerabilities for controlled substance diversion in the medication use processes of 2 Ontario hospital pharmacies. A growing number of controlled substances, such as opioids, are going missing or being stolen from Canadian hospitals. The theft of medications by healthcare workers for personal substance use or trafficking is called diversion. It is increasingly recognized that hospitals lack robust processes, tools, and technologies to detect and investigate incidents of diversion. Improving our ability to detect and prevent diversion is important because of the harms diversion causes not only to the person who diverts, but also to patients and hospitals. Since pharmacies have a central role in the safe management of controlled substances, the objectives of our study were to identify vulnerabilities for diversion in the medication use processes of 2 inpatient pharmacies and to characterize the types of vulnerabilities that we identified. Acknowledging that there are several system factors which can increase the risk of diversion in a hospital, we decided to use a human factors approach in that it embraces this system complexity. We conducted a multi-method study where we used a proactive risk assessment called a healthcare failure mode and effects analysis that was informed by observations. We observed pharmacy staff as they conducted the tasks involved in procurement, receiving, packaging, and distribution of controlled substances. We identified 220 failure modes or ways in which tasks could fail, which could be used to divert. Of these, 34 were prioritized as critical failure modes in that they were sufficiently severe and not easily controlled or not so obvious as to need a control. The critical failure modes were categorized as related to handling, data entry, or verification tasks. Examples of critical failure modes include leaving controlled substance unattended and outside of locked compartments, or falsifying medication counts to obscure inventory discrepancies. Our study provides some much-needed detail about how specific vulnerabilities in medication use process tasks lead to an increased risk of diversion. Our work in this area continues as we look into other patient care areas, including hospital intensive care units and emergency departments.